PRP for knee pain. How can PRP cure your knee pain and what to expect? PRP treatment can treat different knee injuries, for example patella tendinosis, mild knee meniscus injuries, knee pain due to arthritis, patella chondromalacia, knee effusion, and knee ligament injury. By following a proven protocol of PRP and rehabilitation, the success rate of PRP treatment for knee are very high and patient can become pain-free without any surgery. The PRP preparation takes about 20 minutes. We do the normal vital signs during the preparation phase. Then we extract 20 to 30 mm of blood extraction. We use a high-end PRP kit to ensure high-quality PPR injection. The preparation process takes about 20 minutes. When the PRP is ready, we inject the PRP under ultrasound guidance into your knee joint. You will experience minimal pain during the procedure. PRP is natural as it is a high concentration of platelets from your own blood. Platelets form clots to stop bleeding at site of injury, but it also starts the healing process and regenerate new tissue cells. We shall integrate your